webinar today. We're going to start with this morning with Mr. Nick Zacconi from HRSA. Nick, can you still hear us? Okay, we might have lost Nick. Ms. Forstall, will you go ahead and provide our welcoming remarks, and I'll try to find Nick?
I will. Tara, thank you. Good morning, everyone, or good afternoon. My name is Doyle Forstall. I'm the Acting Regional Director for the U.S. Department of Health and Human Services here in Region 8, which covers the states of Colorado, Wyoming, Utah, Montana, North Dakota, and South Dakota. So we're delighted that all of you are joining us today. Really during this historic time in our country's history when we're about to launch, one of the major provisions of the new healthcare law are what we call our health exchange, or our new health insurance marketplace. And this webinar today is really designed to help make sure that we can let American Indians and Alaska Natives know specifically about those provisions that are there specifically for you, and that you can take advantage of many of the new pieces of the healthcare law. Of course, there are many of the provisions that, several of the provisions of the Affordable Care Act that benefit Native Americans specifically. And want to just be sure that folks know that one of those biggest pieces, beyond accessing the new health insurance marketplace and having access to new health insurance options, this idea of preventive services and really shifting to trying to keep folks healthy and making sure that people are on a road to health and wellness before they end up in the doctor's office or the emergency department. So really want you all to know that that's a big piece of the law. Things like mammograms, cervical screenings, colonoscopies, childhood immunizations, those types of things are now available in your insurance plans without any copay if you do have private insurance. But beyond that, a lot of what we'll be talking about today is the new health insurance marketplace, which creates a new opportunity for individuals and small businesses to purchase that health insurance. Being able to compare what's available, apples to apples comparisons, and really pick the plan that makes the most sense for your family and for your budget. There are special provisions for American Indians and Alaska Natives as it relates to the new health insurance marketplace. So for example, when you purchase insurance through that marketplace, it eliminates cost sharing for those individuals whose income is under 300% of the federal poverty level, which is roughly about $66,000 for a family of 4. There are new opportunities with Medicaid expansion if you live in a state that opted to expand Medicaid. There are special enrollment periods every month throughout the year for American Indians and Alaska Natives, and you should know that you are exempt from that individual mandate. So if you're a member of a tribe, you won't have any type of penalty for failing to carry some type of minimum coverage. But most of all, we want people to know that through the Affordable Care Act, the Indian Healthcare Improvement Act was permanently reauthorized. And so the goal is really to make sure people know that the healthcare law does not damage Indian health services, but it permanently reauthorizes it, and also includes new authorities to provide new services at its facilities. So those are just some of the key pieces that I know Nick is going to walk through with you in more detail. But I just want to say welcome and thank you so much for getting on the phone with us today and joining this webinar, and hopefully we'll answer a lot of your questions. And with that, Tara, I'll turn it back over to you.
Wonderful. Thank you so much again for joining us. We have been doing this PowerPoint for quite some time, but we have actually never done it as a webinar. So we're really thankful that HRSA and the region asked us to sort of to do this and provide some information and hopefully answer some lingering questions, especially as that October 1st deadline happens less than 12 hours from now for some of us. So, you know, we're very excited. And I just wanted to start off and run through some logistics of the actual webinar use and how to use your panel that you might see on your right or left-hand side of your screen. So you'll see the screen here, this panel that I'm talking about. It has GoToWebinar at the bottom. You won't see the NS Sales Solution. That's just a sample. But this panel right here is actually very important, and it's a way for you to communicate with us during the webinar today. There are a couple of ways to correct things. We know that people often have trouble kind of getting started. One quick note is that for that panel, like I was talking about on the left or right-hand side of your screen, you can minimize it by clicking that orange arrow that the square is now around, and it'll minimize to very small so it doesn't take up your full screen, and you can continue to see the PowerPoint presentation. You can also open it back up by selecting that same orange arrow. You can then sort of figure out your audio. We recommend that you use the telephone if you're going to ask a question at the end of the PowerPoint today. I would recommend that you go ahead and call in on a landline phone and use the audio pen that you can find. Here I would select the use telephone, which is this piece right here where the red square is, and then log in, dial in the number, the access code, and the audio pen. It just helps us hear you a little bit better, and you can hear us better when we're answering your questions that way. There's another way to answer or to ask questions. You can use this raise your hand button, and I will send you a chat and ask you what your question is, or I will call on you. So you can click on that button. You can also submit text questions by using the questions box in your panel. You can just type it up and send the question over, and we'll either answer it or send you a chat right back so that you have a quick answer. Or if we think it's a really great question, we want everyone to hear the answer, we'll read it out loud and then answer it on the phone. So those are just a couple of ways. We will have the question and answers at the end of the webinar, and we'll send out an email in 24 hours with the recording of this webinar. So if you have people in your facility or other individuals in your community who you might want to share this information with, you can certainly do that tomorrow after we send out that webinar recording link. So I'm going to hand it over to April Hale from the National Indian Health Board, who is the Healthcare Reform Project Manager at the Health Board, and she'll get us started with the content today. April, So April, we can hear you now.
Okay, thank you, Tara. As Tara mentioned, my name is April Hale. I am the Tribal Healthcare Reform Project Manager at the National Indian Health Board here in Washington, D.C. First, I'd like to welcome all of you who are joining us today for this webinar entitled The Health Insurance Marketplace for American Indians and Alaskan Natives. This PowerPoint presentation is brought to you in partnership with the Indian Health Service, IHS, the National Congress of American Indians, the National Indian Health Board, and the National Council of Urban Indian Health. The intended purpose for this PowerPoint is to provide basic information about the special protections and unique opportunities under the Patient Protection and Affordable Care Act. We hope this information will help you understand the new changes to the Indian Health Service, your local clinic, and health insurance overall. So as Tara mentioned, there'll be time at the end of the webinar for questions. So today we'll learn more about improvement to the Indian Health Service, Medicaid expansion, Medicare, and the Affordable Care Act, the health insurance marketplaces, and eligibility and enrollment. Throughout this presentation, we'll also highlight the special provisions and protections under the Affordable Care Act for American Indians and Alaskan Natives. As many of you already know, President Obama signed the Patient Protection and Affordable Care Act into law more than 3 years ago. The law is more commonly known as the Affordable Care Act, and throughout this presentation, you'll hear us refer to it as ACA. So the Affordable Care Act protects the rights of all Americans, including American Indians and Alaska Natives, to access affordable health care through Medicaid expansion, improvements to the Indian Health Service, and the establishment of insurance marketplaces. You may have heard the term exchanges. Earlier this year, that name was changed to marketplace by the U.S. Department of Health and Human Services. The terms mean the same thing. As a result of these changes, more than 32 million individuals in this country who would not otherwise have health insurance will have access to health coverage. The new law has specific and unique benefits to tribal communities and people in a number of ways, which will be discussed throughout this presentation. The federal government's trust responsibility to provide quality health care to American Indians and Alaska Natives is one of Indian country's main talking points that is carried to Capitol Hill, federal agencies, and the administration. As we all very well know, tribes and the federal government have a unique government-to-government relationship that is based on numerous treaties and laws. Passage of the Affordable Care Act marks a continued commitment to the historical and unique legal relationship with tribes. Healthcare reform reaffirms the federal commitment to provide health care based on hundreds of treaties and numerous laws and Supreme Court decisions. The law supports, strengthens, and recognizes the entire Indian Health Service delivery system as the primary health system for American Indians and Alaska Natives, all the while providing new opportunities to access affordable or free health insurance through a variety of programs. There are a number of new provisions specific for American Indians and Alaska Natives under the Affordable Care Act. For instance, the law permanently reauthorizes the Indian Healthcare Improvement Act, or IHCIA, ending more than a decade-long legislative battle to maintain the Indian Health Service for future generations. In addition to the permanent reauthorization, health reform strengthens the entire Indian health delivery system, workforce, and care. The law provides new opportunities for IHS, tribal, and urban Indian health facilities to collect additional revenue, offer more services, and serve their patients more effectively. The ACA also builds a pipeline for new healthcare professionals. This means more nurses, physicians, and psychologists in Indian country. It also means more culturally competent and efficient care when you visit the IHS clinic in your community. The law also establishes new insurance marketplaces to help control the cost of health insurance and allow individuals to have access to affordable coverage. These marketplaces will provide special exceptions and opportunities for members of a federally recognized tribe to enroll in health insurance plans, which we will discuss in just a moment. Strengthening Indian health. First, IHS has new authorities to expand services. The reauthorization of the Indian Healthcare Improvement Act, which prescribes the duties, responsibilities, and authorities of the Indian Health Service, allows IHS to modernize its healthcare delivery systems and permit tribal governments to make technical changes in the future. Some of these new opportunities include new and expanded programs for mental and behavioral health treatment and prevention, long-term care services, including home health care, assisted living, and community-based care, dialysis services, funding of patient travel costs, and facilitated care for Indian veterans. Secondly, IHS can increase providers and nurses. The ACA can improve your local facilities by utilizing provisions of the law to expand your healthcare workforce through new resources that will boost the number of doctors, nurses, and healthcare providers in American Indian and Alaska Native communities. The Health Resources and Services Administration, or HRSA, designated that all Indian Health Service, tribally operated facilities, and urban Indian health programs as National Health Service Corps sites, so vacancies can be filled in your clinics. The National Health Service Corps and the Indian Health Service offer primary care providers and financial support for financial support for students in the form of loan repayment and scholarships to cover the cost of their medical, dental, or mental and behavioral health education. Lastly, IHS can increase revenue through third-party billing. Medicare, Medicaid, the Children's Health Insurance Program, and private insurance-covered populations will increase payments to IHS to support both direct care and contract health care services. This will free up IHS funds for expanded services. When private or government insurance money, otherwise known as third-party billing, is added to the Indian health system, it will help improve services for all American Indians and Alaska Natives. The new law opens up many avenues for tribal and urban Indian clinics to bill insurance plans. Third-party billing will add new money because tribal facilities will be able to collect reimbursements from private insurance directly. More opportunities to bill outside the IHS system will help facilities and areas stretch the all-important contract health service dollars. These new opportunities also mean facilities might need to consider new business processes and implement enrollment plans for tribal citizens into private insurance plans. Together, the Affordable Care Act and the Indian Health Care Improvement Act strengthen the entire Indian health service, from building pipelines for providers to increasing sources for third-party billing and protecting those precious contract health dollars. However, the law does not provide additional funding for all new authorities, and additional funding may be needed to implement some of the provisions noted earlier. This means that IHS is here to stay and will likely continue to get better as we move forward with implementation of the law over the next year and decade. Medicaid expansion for Indian country. Medicaid has long been a source of revenue for IHS and a way for American Indians and Alaska Natives to access health care. Now, under the Affordable Care Act, states can expand who is eligible for Medicaid. States have the option to expand Medicaid eligibility to adults ages 19 to 64 with an income of up to 138% of the federal poverty level, which is about $15,282 per year for an individual and about $31,322 per year for a family of 4 in the lower 48 states. The numbers are slightly higher for those in Alaska, which is about $19,086 per year for an individual and about $39,155 per year for a family of 4. With an average income of $35,192 for American Indians and Alaska Native households, more will be able to enroll in Medicaid and earn greater access to health care. American Indians and Alaska Natives enrolled in Medicaid who are eligible and do receive care at an IHS facility, Tribal 638, or an urban health care clinic that do enroll in Medicaid through expansion will not have premiums or deductibles. They will also not pay any copays for services received from a healthcare provider or through referral from contract health services. This is a map of what Medicaid expansion looks like for the country. As you can see here, those states in yellow are leaning against expansion. Those in blue are expanding. Take a moment to look at Medicaid expansion, what Medicaid expansion looks like in your state. Okay, moving on to Medicare. Medicare is another opportunity for insurance coverage that many of our elders are already enrolled in and receiving benefit from. Under the new law, Medicare has also improved. One benefit is cheaper prescription drugs. If you're in the donut hole, you will receive a 50% discount when buying brand name prescriptions when you fill your prescription. You don't have to do anything to get it. It's automatic. There will be free preventive services. Medicare now covers certain preventive services, including free wellness checks. Doctors are supported to better coordinate your care. They are working to get you the care you need and the time you need it and provide the highest quality care possible. The law also fights fraud, strengthens Medicare, and protects federal funding. The Affordable Care Act bills efforts to combat fraud and abuse. These efforts are saving billions of dollars in money that was being stolen from people with Medicare. Lastly, the Medicare coverage is protected. Just like IHS, under the new health reform law, your existing Medicare covered benefits will not be changed. So what if you're not eligible for Medicaid or Medicare? Or what if your state isn't expanding Medicaid? The law offers another opportunity to access health care insurance, and that is through the insurance marketplaces in each state. These marketplaces will start enrolling American Indians and Alaska Natives on October 1st, which is tomorrow, and will begin providing private coverage and protections on January 1st, 2014. So a quick introduction to the marketplace. When key parts of the healthcare law take effect in 2014, there will be a new way for individuals, families, and small businesses to get health insurance. Whether you're uninsured or just want to explore new options, the marketplace will give you more choices and control over your health insurance options. When you shop at the marketplace, everything you need is laid out for you. All your costs are stated up front, so you'll get a clear picture of what you're paying and what services you're getting before you make a choice on a plan. Every health insurance plan in the new marketplace will offer comprehensive coverage, from doctors to medications to hospital visits. You can compare all your insurance options based on price, benefits, quality, and other features that may be important to you. In the marketplace, all coverage options are stated in plain language that makes sense. You'll know what you're getting. You know you're getting a quality health plan at a reasonable price because there's nothing buried in the fine print. The marketplace will make purchasing health insurance easier and more affordable. Each will offer 4 ways to enroll yourself and your family. Most people willing to purchase insurance will be able to get a break on costs through subsidies and cost-sharing opportunities. This eases the overall out-of-pocket costs for your health care. In fact, 90% of people who are currently uninsured will qualify for low-cost or free health insurance. Also, insurance plan options will be clear and comparable based costs and benefits provided. The marketplace is much like shopping for an airline ticket. In the exchange, you will be able to see what plans offer, how much they cover, and what your total spending will be. And each plan will provide new protections for you and your family starting on January 1st, 2014. More people than ever will likely qualify for free or low-cost insurance in 2014. When key parts of the healthcare law take effect in 2014, more people than ever will qualify for health insurance that fits their budget. You may be eligible for free or a low-cost plan or a new kind of tax credit that lowers your monthly premiums right away. If you earn between $11,505 to $46,021 for an individual, or $23,425 to $93,700 for a family of 4, you don't have coverage from your you don't have coverage from your employer. You can qualify for an upfront discount in the form of a tax credit on health insurance in the online marketplaces. You will provide relevant information to the marketplace, and it will determine how much, if any, discount you can get. The amount of the discount is tied to your family income, family size, and the cost of a standard plan in the exchange. The discount will go directly to the insurer you choose to help pay the full premium up front. If you earn less than $34,516 for an individual or $70,275 for a family of 4 and purchase your policy on the marketplace, you also can get subsidies to lower out-of-pocket costs, such as deductibles and copayments. If you earn less than $15,302 for an individual and $31,155 for a family of 4, you will qualify for Medicaid in 2014, but only in those states that decide to go along with federal expansion of the program. In states that don't expand Medicaid, households with incomes above the poverty level will be able to purchase insurance on the online marketplace and receive tax credits. Protections for Indian country in the marketplace. For instance, members of federally recognized tribes will not have any out-of-pocket costs using Indian Health Service. So you'll be able to go to your local clinic and receive a referral without any cost to you or your family. Additional cost sharing is available for any individual, whether enrolled or not, with an income below 250% of the federal poverty level who purchases a Marketplace Silver plan and receives the new tax credit. And there won't be any co-pays anywhere for an individual American Indians earning less than $34,470 and families earning less than $70,650 a year. Members of federally recognized tribes can also choose to change their status in the exchange once a month. This means if your circumstances change, you can change your insurance when you need to. And at the end of the day, all American Indians and Alaska Natives eligible for Indian Health Services are exempt from the federal requirement to maintain a minimum insurance coverage. So if you're happy with your health care and services provided at your local clinic, you do not have to go to the insurance marketplace at all. So what will your marketplace look like? Here is a map of what the marketplace will look like throughout the country. So you've heard a little bit about the marketplace and all the advantages that American Indians and Alaska Natives benefits. So you might be asking who is running these marketplaces and what kind of plans will be available. Just like Medicaid expansion, the answer is different for every state. States have the option of running their own marketplace or partnering with the U.S. Department of Health and Human Services, HHS, to partially run the marketplace called a partnership, or opting for a marketplace run by HHS called a federally facilitated marketplace. One thing that is the same is that every state will have an insurance marketplace to enroll in beginning on October 1, 2013. Now I will hand it over to my colleague, Bethany Rose, at the National Council of Urban Indian Health, who will talk to you about the qualified health plans and more about the marketplace. Bethany?
Thanks. So my name is Bethany, and we're going to go through the rest of this now. So first, what are qualified health plans? Plans available in the insurance marketplaces are required to meet a minimum set of requirements which make them qualified health plans, or QHPs. QHP status means that the insurance plan has been certified by the marketplace. Either your state or the federal government has deemed that they meet all of these requirements. Each of these requirements are meant to protect you, the consumer, and ensure that you can access the same basic health care as others in the marketplace. All plans in the marketplace are required to cover 10 essential health benefits, follow established limits on cost sharing, including deductibles, copayments, and out-of-pocket maximum amounts, and meet other requirements. For example, each issuer must agree to offer at least one qualified health plan in the silver and gold level of the marketplace. Okay, so for the 10 essential health benefits, all qualified health plans will cover these benefits. You'll see that some of these are those that aren't available at every clinic, particularly behavioral health and pediatric oral and vision care. So for the 4 levels of coverage, even though each plan level must cover the same set of minimum essential health benefits, the value of these benefits will vary across the 4 metallic levels, the bronze, silver, gold, and platinum levels. This means that the amount of cost sharing required will differ in these tiers. For example, bronze plans will have the least generous coverage with more out-of-pocket costs for enrollees, and platinum plans will have the most generous benefits. However, these plans might be the best choice for federally recognized tribal members because you don't have any cost sharing for essential health benefits and may qualify for those premium tax credits as mentioned earlier. What this really means is that you should use the tools provided in your marketplace to explore the options and make sure that your local clinic or provider is part of the network. Now that you know all about the plans, protections, and special opportunities available to you, you need to know how to sign up. To be eligible to enroll in an insurance marketplace, you must live in its service area and be a United States citizen or national or non-citizen who is lawfully present in the United States for the entire period for which enrollment is sought, and you cannot be incarcerated. Determining eligibility for Indian benefits. To qualify for special Indian protections mentioned earlier, insurance marketplaces will request documents that demonstrate your status as a member of a federally recognized tribe. You can present your tribal identification card, BIA form, or CDIB card to the marketplace as verification. One quick note as you're gathering documents, make sure the document you choose to bring with you to enroll clearly indicates that you are a member of a federally recognized tribe. This will save you time and confusion during the application process. All right, how to apply. So after you've gathered all of your documents and thought about what is best for you and your family, you're ready to apply. The good news is that enrollment is going to be easy. There is one application to determine your eligibility for Medicaid, CHIP, and the cost-sharing opportunities for private health insurance that we discussed earlier. You can sign up online at healthcare.gov. It's an easy-to-use website where you can search and compare plans using the online application, or you can use a paper and telephone application with a toll-free hotline that you can call to talk to someone about your options, or you can apply in person by going to an identified location in your community. Many states are going to deploy people across their state to sign up consumers when enrollment in the health insurance marketplace opens on October 1st. The squads of trained government-paid helpers will be armed with the knowledge to untangle the complexities of insurance coverage. In addition, many states will open call centers staffed by consumer service representatives who will explain the 2010 healthcare law and guide callers through their health insurance enrollment. For the application process, you will submit one application when applying for insurance. You can submit the application in whatever way best suits you, whether online, by phone or mail, or in person. The system will verify and determine your eligibility for Medicaid, CHIP, or private insurance subsidies. Following that, it will then help you enroll in whichever program makes the most sense for you in your pocketbook. So in 2014, people who can afford to purchase health insurance and who are not eligible for minimum essential coverage exemption but do not purchase insurance will pay a shared responsibility payment. Beginning in 2015, the IRS will collect the payment via tax returns. During the first year, the payment will be up to $95 a year, or 1%, or up to 1% of your income, whichever is greater. But starting in 2016, the payment will rise quickly to $695 per person, or 2.5% of your income, again, whichever is greater. The tax payments will be capped at $285 in 2014, but could cost you up to $2,085 in 2016. You might be exempt from payment if you're eligible to receive services at IHS, or if you have insurance through your employer or purchase individual insurance on your own, or if you have insurance through Medicare, Medicaid, the Children's Health Insurance Program, which is known as CHIP, the Veterans Administration, and or TRICARE for active duty and retired military, or a health care sharing ministry. Or you would have to spend more than 8% of your household income on the cheapest qualifying health insurance plan, even after tax credits and subsidies. So what are the benefits of enrolling in health insurance? Now that you know all the details, why should you even consider purchasing insurance? Let's start at the beginning. We learned earlier that your local clinic can increase their revenues under the law because of the changes to billing practices and expanded access to insurance for individuals. We also learned that some individuals may not have to pay anything for coverage, even though through Medicaid and the insurance marketplaces. So now think about what happens when you're insured and you go to the local clinic. Your local clinic bills for the services they provided and gets paid from the federal government or insurance company for those services. That means that they haven't lost any money seeing you, which means that there will be more resources for your clinic because insurance companies will pay these costs instead of contract health services. All in all, that means that your health care needs will be met and you're helping your local clinic. Important dates and highlights. So let's remember the two major healthcare dates that are approaching rapidly. October 1st, tomorrow, is when the health insurance marketplace opens for enrollment. And on January 1st, 2014, health coverage begins. This is a historic time for those Americans who never had health insurance, who had to go without insurance after losing a job or becoming sick, or who had been turned down because of a pre-existing condition. Because of these new marketplaces established under the Affordable Care Act, millions of Americans will have access to affordable health insurance coverage. Key points to remember. So the key points to remember from today are that more American Indians and Alaska Natives will have access to affordable health care. Whether you're a small business or an individual consumer, you can find a plan that fits your budget. Many will be eligible for low cost or free health care. And if you invest in the marketplace, you'll be saving contract health service dollars. So to learn more information about insurance options in your state, visit www.healthcare.gov. You can even go there to chat with the sisters who can answer any additional questions you may have. The National Health Outreach and Education Initiative is a national partnership through the National Indian Health Board, the National Congress of American Indians, and representatives from each of the 12 IHS areas. In addition, the National Council of Urban Indian Health is conducting training at the Urban Indian Centers. NIHO also thanks the generous support of the Indian Health Service. So I think at this time we're going to turn it over for questions.
Hi, this is Tara Branson, the Legislative Associate at the National Congress of American Indians. I just want to remind folks on the line, I'm not going to unmute everyone because that will cause lots of chaos. However, if you want to ask question, you can raise your hand like we discussed earlier today using this red square where your hand raises, and I'll either unmute you or send you a private message and indicate that I'm unmuting you. Or you can ask a question using the question box. We have a lot of questions already, so we're going to get started with the questions that we have. For our panelists, I've unmuted all of you, so I'll just assign them as we move through and hope that we can come up with an answer collectively. Jennifer, one question. Can you hear us, Jennifer?
I can. I'm online. Thank you.
Excellent. Just checking. One of the questions that came through was that they're having trouble navigating the online application on the healthcare website to sign up as an American Indian. Can you explain a little bit about the application process and how American Indian Alaska Native status will be verified?
I sure can, and I know that folks were having trouble with the online application, and there is also a paper application which folks could utilize too. So individual can, as noted in our presentation today, an individual can have assistance and apply through the marketplace, whether it's online or in person. And the paper application is a bit easier, but unfortunately, we have heard that online is a little bit different. And I have not walked through the online personally, but it is there is a separate form for the American Indian Alaska Native status. Now, in terms of verifying that and seeking the exemption from the shared responsibility payment, or the requirement and documentation for having health insurance coverage, an individual may seek, members of federally recognized tribes may seek this through the marketplace and apply for an exemption that way, and you'll receive an exemption certificate number that will be used on your tax form. So again, this declaring that you have coverage will happen in 2015 when through filing of your taxes. So IRS will have that number, and you'll be able to acknowledge it on a form. Now, with for individuals who are able to access their Indian health services but may not be enrolled, so they may qualify as an Indian health beneficiary, whether being a descendant, or they may seek a hardship exemption waiver. And that waiver is going to be available. There is, IHS is developing a form, and it should be out and available at IHS facilities, and that form will be completed and submitted. So we haven't seen that form, but we have heard of it, and it's going to be made available shortly. But again, I think the biggest point here is that both of these documentations are going to be retroactive, and also that this documentation will be also only needed once the filing of taxes happen in April of 2015.
Fantastic. Thank you, Jennifer. There was another question about the difference between the $70,650 for American Indian Alaska Native family of 4 versus the approximately $94,000 for a family of 4. I'm just going to pull up those slides so that the audience can see that really quickly. This user is asking about the tax credits for the $94,000, and then on the American Indian Alaska Native protections, we use this $70,650. And this is for the break-on cost. This is for the out-of-pocket cost versus the tax premium, the APTC. Jennifer, could you maybe clarify?
I'm hurt. I missed your. So the first slide was in regards to the potential of advance premium tax credits. So, and the income that relates to that. So that this is the credit that will help to cover the premium. So we have the range and $23,550 to $94,000. And we probably will have better numbers now that we have some figures out there, and that just came out in the past week, or past couple of days actually, on Friday or Thursday. And then the next slide. So that was for everyone throughout the country who falls into this range. Now we're in this slide that we have, it's dealing with individuals' protections for Indian country in the marketplace. And here we are talking about, I forgot what we're talking about here.
The primary difference is that on the advanced premium tax credits, all Americans are eligible for that, for the advanced premium tax credit under 400% of the federal poverty line. However, when you get to the second slide, members of federally recognized tribes under 300% of the federal poverty line are eligible for the protections of the out-of-pocket costs. So if they were to purchase insurance through the private health market, through the marketplace, they would be eligible for the advanced premium tax credit up to 400%, but then would get the out-of-pocket cost reductions up to 300%. So that's actually the difference in the numbers. It took me a second to figure out what we're talking about, unfortunately, but it's because the first one applies to all Americans. So every American up to 400% gets a tax credit on their monthly premiums to reduce the overall cost, while American Indians get a cost protection up to 300%. So that's that $20,000 difference.
Thank you, Tara.
Sorry, I just realized it.
No, it took me a second too, so I appreciate everyone's question. And you know, there are a lot of figures in this, and it's great to actually stop and answer these type of questions.
The next question we have is, do all Native Americans need to complete an application to select IHS as their marketplace? So I believe the correct answer here, this is Tara from NCAI, is that American Indians, Alaska Natives do not need to go to the marketplace and select IHS as their insurer. IHS provides health care services, but they do not actually, as a system, meet the minimum essential coverage requirement under the law. So if you wanted to go to the marketplace, the reason you would go to the marketplace is to enroll in Medicaid or Medicare, or try to enroll in private insurance with those reduced costs that we've discussed on the webinar. If you are looking for the exemption, which Jennifer mentioned earlier, IHS is still formulating a process to verify that you're an active IHS user, which means that you qualify for that hardship exemption that was issued by the Department of Health and Human Services Secretary in June, at the end of June. So we're actually still waiting on that process. So my suggestion, if your question is really about meeting that minimum essential coverage requirement under the law, is that members of federally recognized tribes are not required to purchase health insurance, and IHS active users can apply for a hardship exemption through the Indian Health Service, and we're still waiting for direction from the department on what that process will look like. So I would encourage you to check back at tribalhealthcare.gov or .org, excuse me, tribalhealthcare.org for more information on the hardship waiver process. Jen, if you can take this next question, that would be helpful. The next question is, if an American Indian Alaska Native elects coverage from the marketplace and sees a provider outside of the ITU system, are they exempt from cost sharing?
They are under 300%.
Okay.
They have no cost sharing.
Excellent. The next question is, what is the enrollment process for people that do not file taxes? I've been asked this question by people that only receive public assistance benefits or only make a minimal amount each year from spot jobs, etc., and live independently, but with other family members, etc. They do not pay rent, bills. What will be the process for filing taxes? I think here, Mr. Wilson, this is Tara. I think we've had this question come up a number of times. We don't have a perfect answer for you. If they make less than the filing requirement, which I would guess is probably the case in this particular situation, they will continue to not have to file taxes. And in that case, they would qualify for a number of exemptions, including that 8.5% of the cost. If at some point in the future they make more than the filing limit, which I think right now is like $12,000, $13,000 a year, they will have to file taxes. And if they're an American Indian Alaska Native who is a member of a federally recognized tribe, they'll be able to indicate in some way to the IHS that they're a member and exempt from the minimum essential coverage. And we've heard from the Indian Health Service and the Internal Revenue Service that the statutory requirement for minimum essential coverage and the hardship waiver and the AIAN exemption are all retroactive. So sort of the once you're an Indian, you're always an Indian will apply in this case. And when they file, you know, they'll be exempt. So they won't have to purchase health insurance because of their income. I believe that answers your question. If it doesn't, shoot me another question and we'll try to follow up with some more detail. Jennifer, the next question. Yes. Are all natives exempt from tax penalties with no exceptions?
Members of federally recognized tribes are exempt from the penalty, the shared responsibility payment, or the tax penalty to enforce having coverage. Then the difference also, again, is an active user of the Indian Health Service, an individual who is a current beneficiary or a patient of Indian Health Service. They are able to seek the exemption from the hardship waiver. So they too would, after seeking this documentation, they too would be exempt from the tax penalty.
Excellent. So here's one question. There's a long waiting list to be seen at the Albuquerque Service Unit. Individuals are regularly turned away. What is IHS going to do to change this? I think this might be a place where we could talk about third-party billing. Jen?
Okay, Tara. So this is one of the reasons we know that IHS has is a system that is currently underfunded, and it's at about 56 on average through the entire system, about 56% of received funding that truly just supports the entire healthcare delivery system. So we know it's hard to access services, and also there's a long waiting line. So this is another reason why individuals and a lot of folks like us in this presentation is really seeking to educate those who have the ability to sign up for coverage, whether it's Medicaid, Medicare, or actually get in health coverage, because you would save, have with that insurance, you would be able to actually see providers outside of IHS if you're unable to get in to receive services through IHS. And on the flip side of that, that actually helps with when you do see IHS services and have that insurance coverage. That insurance coverage is also able to support the Indian Health Service by IHS is able to charge and seek payment from that that coverage from the insurance company, and that in the end will actually save what we know is also a precious part of the system, which is our contract health service dollars. So by having coverage, that special pot of money for contract health services being saved for those who are really in dire need of it, but also the individual would have possible other avenues to seek care too by having coverage.
Excellent. So here is the next question. When enrolling in the marketplace, are descendants of federally recognized tribes exempt as well?
And again, this question goes to the hardship exemption waiver that we've been speaking about. So a descendant who accesses, goes to the marketplace and seeks an exemption would be exempt from exempt from the penalty to enforce the tax penalty that is being levied to for those who do not have coverage under the Affordable Care Act.
Fantastic. On January 1st, 2014, will pre-existing illnesses be prohibited? Will issuers be able to deny coverage to those with pre-existing illnesses?
No.
Excellent.
It's a simple answer, and that is one of the benefits of the Affordable Care Act.
If a federally recognized American Indian does not want to purchase health insurance, do they go to the marketplace to receive their exemption? How do they submit their proof of citizenship? And once their exemption is given, what is the process for submitting it to the IRS? So we haven't, this is a place where the federal government hasn't issued all of the requirements or the processes. So we're not sure how the exemption is being run by the Internal Revenue Service yet. We've heard a couple of theories at the national level. We haven't worked out that process yet. We do know that you can go to the marketplace and get a couple of different exemptions. And Jennifer, if you can jump in here and tell me that I'm wrong, that would be helpful. But we're still unclear how the marketplace, each marketplace will be different in every state on how they collect the information about your status as an American Indian or Alaska Native person who is statutorily exempt from the law. Is that correct, Jen?
That is correct. Unfortunately, we don't have more information at this time about this, but those are the details we have right now.
And we'll, again, provide updates to the website when we have more information. The next question is there a premium for smokers now that is 75% or 50% higher than non-smokers' premiums? Jen, do you want me to take this?
Yeah.
Okay. So the premium so one thing under the Affordable Care Act that is allowable in terms of a pre-existing condition is for health insurance issuers to require a higher premium from smokers than non-smokers. And the application does ask a couple of questions about your smoking habits. there are ways to reduce your premium. You can enroll in a smoking cessation program, and you can do that both through your employer or through the individual marketplace. So yes, the premiums will be higher. They're actually pretty significantly higher if you're looking at employer-sponsored insurance. I haven't, because the premiums for private insurance offered through the marketplace were just published last week, I have not gotten into the details about how the private insurance marketplace established will change based on smoking versus non-smoking. So I can tell you through the employer marketplaces, smokers will have to pay a higher premium through their employer-sponsored insurance unless they sign up for a cessation class. The next question is, when you say IHS active user, does this mean if you have not used IHS ever, you need to enroll with your local clinic to qualify for the hardship exemption waiver? And if you have a active chart with IHS but have not visited the clinic for a long period of time, will you still be able to qualify for the hardship exemption? Jen, can you talk about this?
Indeed. This is basically anyone who qualifies for Indian Health Service care or care provided by Indian Health Service will be able to access the hardship waiver exemption. So if you have not been to IHS for a bit, but you have accessed IHS services before, and you've qualified for Indian health care, then you would be able to seek the exemption, the hardship waiver.
Excellent. Okay, sorry, I'm just trying to find. How would a native and non-native married couple with children be handled? Would this be considered a native family? So this is Tara, we are still not 100% clear from the government. We have not gotten 100% clear messaging from the government on what blended families will experience when the requirement takes place January 1st, 2014. What we do understand is that the marketplaces have reacted to the law, and they are providing different plans based on family types. So the marketplace will offer individual insurance coverage and may offer family coverage, but it may also offer just dependent coverage for children. So they might have their own individual plans. So quite frankly, some of this has not been worked out, and the regulations have not all been formalized. And so we're still trying to figure out from the national perspective what that means at a local level. What we do understand is that you can go to the marketplace and buy individual coverage. So what we believe is going to happen is that families will have to sign up for 2 different insurance plans. You'll have to, if the kids are Indians for purposes of the law, then they can be on a family plan with the spouse or the parent who is also Indian, because they will qualify for the cost-sharing reductions and other special provisions outlined on this slide. However, if and then the spouse who is non-native will likely have to purchase another plan, a separate plan as an individual, and use household family revenue, I guess, income to qualify for individual insurance in the marketplace. And again, in full transparency, this is going to continue to be a complicated issue with families who have employer-sponsored insurance and are offered employer-sponsored insurance, but don't want to take it for their spouse or for their children. They can go to the marketplace and purchase the coverage in the marketplace. The next question is, does the exemption from cost sharing include services provided by non-ITU facilities such as specialty care, prescription drugs, and hospital stays? Jennifer, can you talk about this a little bit?
Can you repeat that? I'm sorry, I missed that.
That's okay. Does the exemption from cost sharing include services provided by non-ITU facilities such as specialty care, prescription drugs, and hospital stays? So I believe the right answer is if you qualify and you purchase health insurance through the marketplace and you're under 300% of the federal poverty line and you get a referral from the Indian Health Service to go get specialty care, then this special cost exemption will apply to you outside of the Indian Health Service as long as you have a referral. Is that right, Jen?
That's right.
Okay. Okay. What if you are not an enrolled member of a tribe, but a descendant of a tribe and can provide a CDIB card? So when it comes to, oh, go ahead, Jen.
Go ahead. No, and again, it sounds like this is regards to exemption from the shared responsibility payment or the individual mandate that a individual would produce this type of documentation when they would seek the hardship exemption waiver.
Right. And I think just to know again on the materials that you have to provide to the insurance marketplace, we're still not sure what state-based insurance marketplaces are going to collect versus federally facilitated marketplaces. We just suggest that the documentation that you take to the exchange indicates that you're a member of a federally recognized tribe. And in this case, obviously, if you're a descendant, you can qualify at the Indian Health Service for a hardship exemption as an active user. So just a clarification, there was a question about the exemption extending to tribal health facility users. We're saying IHS users. I believe when we say IHS users, we're including anyone who uses the ITU system. Their data is reported to a data national warehouse, and that's the data hub that is being used to verify Indian Health Service active user status. So even those who go to tribal facilities, they will be able to access the hardship exemption waiver that was issued in June. Okay. Sorry, there are some questions that build on each other. Will American Indians and Alaska Natives ever have the monthly premiums waived or reduced? Jen, can you answer?
I can answer that. We, during the legislative process, we tried to seek that particular exemption or requirement, and unfortunately, it wasn't successful. The other recommendations are to have the other avenues that folks are considering are seeking assistance from their tribe if their tribe decides to sponsor and provide assistance for premium coverage through the marketplace, but that is a tribe-by-tribe decision. I really don't know of many tribes who are going that way for sure yet. But that was one of the recommendations that are out there to help with the premium assistance.
I'm just trying to read through these to make sure that they're not ones that we've already answered. When enrolling in the marketplace, are descendants from federally recognized tribes exempt as well? So descendants from federally recognized tribes will likely be able to qualify for the hardship exemption if they're an active user of the Indian Health Service. Jen, can you give some background on the legislative history of why the hardship exemption was necessary? I think this sort of boils down to our legislative efforts that we've been using at the national level.
Indeed, and hopefully this will help with some of the distinctions between the waiver and the statutory exemption that was provided. So through the legislative efforts, when this law was passed some time ago now, we were seeking to replicate some of the special protections that are out there currently for that are currently in Medicaid or other protections, and obviously one of them was a recognition of that American Indians, Alaska Natives have access to the healthcare delivery system under and through the Indian Health Service, and that was a representation upholding the trust responsibility, and that stemmed from that. So the requirement to have insurance on top of that was not needed. That was one of the reasons why we were looking for an exemption from having coverage, even though that coverage is not quite extensive and similar in every area. But we know that Indian Health Service itself is available. So through that effort, that was the definition was included in reference to some current acts, and but unfortunately, once the law was passed, it was passed, and we were realized that reference, statutory reference in the law, didn't really reference the definition that's currently used to determine who has access to Indian Health Service. So it doesn't capture everyone who currently has access, whether it's through Indian Health Service or also through the Medicaid program. So to line up the current health delivery system with the current, what was in the definition, there's the national organizations, the area Indian Health Boards. A lot of advocates have been asking for a legislative fix to line it up. Unfortunately, thus far, that legislative fix hasn't happened, but at the same time, there was a request through regulatory process that would do the same thing. And in the slide that's still currently up in front of you, these are all the special benefits available for American Indians and Alaska Natives, but because of this, the nuance to the statutory references, we were the first two, the cost sharing and the special enrollment, are only for members of federally recognized tribes. But the exemption from having health insurance coverage or documentation, or the exemption from the penalty to enforce this coverage through regulatory process, the creation of a waiver occurred and was approved through HHS. So 1 out of 3 right now is in line with everyone who is able to access Indian Health Service. And tribes, the national organizations, are still trying to seek a legislative fix to cover the other 2. By this time, there hasn't been one yet.
Okay, so we've had a number of questions about whether or not the webinar will be available after today. So just a few things, really quick housekeeping things. So the webinar that we did today, the PowerPoint slides that we provided today, are already available on www.tribalhealthcare.org. Again, tribalhealthcare.org. Or we'll send an email tomorrow to all of the registrants and attendees with the recording of this webinar, and you can play the webinar in your facility or for other people, and that will remain available. I think it's up to 60 days. So after it expires on our webinar service, we will post it to YouTube, and you can access it through YouTube. So that's another possibility to access. I just wanted to go over that really quickly because there were a couple of questions about that. Okay, so one question was about American Indian and Alaska Natives who are federal employees and have access to the Federal Employees Health Benefits Program, and whether or not they can still go to the marketplace and purchase more affordable coverage through the marketplace. If you are offered insurance through your employer that meets minimum value and is less than 9% of your income, then you will not qualify for the advanced premium tax credit in the marketplace. So I'll repeat that again. If your employer offers you insurance that meets minimum value and does not cost more than 9% of your total income for you as an individual, for your individual employee insurance plan, then you will not qualify for the advanced premium tax credit in the marketplace. However, that does not mean that you cannot go to the marketplace and compare costs for your family or for individuals in your family who are American Indian and Alaska Native and purchase health insurance through the marketplace. You can purchase health insurance through the marketplace, and the cost-sharing reductions will be extended to those who are enrolled in plans in the marketplace as long as your family income is less than 300% of the federal poverty line. So just to recap, if your employer offers you insurance, you will not qualify for the advanced premium tax credit, which means that your premiums will cost the full amount in the marketplace. In some states, that's $200 or $300, and you will still be eligible for the cost-sharing reductions. So the only thing you're not eligible for is for the advanced premium tax credit in the marketplace. The next question is, if a child does not yet have papers or ID from a federally recognized tribe, and Medicaid does not, and they're not eligible for Medicaid, how will they be exempted from the law? So go ahead, Jen.
Oh, and again, this is falls into the nuance of having the hardship exemption waiver and seeking that through having that. And again, once you have that, that is retroactive, and also can go forward too with that. So, and again, once there is documentation of membership, that file can be updated.
Jen, can you answer this next question? Are contract health service dollars being utilized to pay insurance premiums? If so, for all federally recognized tribal members in their CHISDA or for their own tribal members?
Excuse me. I don't know of anyone who is using their contract health service dollars to pay for premiums. Now, we're saying that that is a possibility, but that would be up to the tribe to decide if they wanted to 638 the program, CHS program. So, and then from that, determine who they may want to cover under that. But at this time, we don't, or I don't know of any tribe that is currently doing that. Tara, do you?
I don't know of anyone. And I think if you're asking about using CHS dollars for premiums, you have to remember that the tribe in that area has to contract the contract health services dollars before they can begin purchasing premiums through the insurance marketplace. And we have a calculator on our website that you can use to calculate the potential revenue that you could gain from sponsoring individuals in the marketplace. And again, that website is www.tribalhealthcare.org. One question, Jennifer. If an American Indian Alaska Native under 300% of the federal poverty line enrolls in the marketplace, are they required to stay in that health insurance network, or are they allowed to use any other health care in the private sector?
There would, it's like having insurance. You would, there's probably going to be in network, and then it's going to be out of network. But also reminding that there, regardless of either way, that they still can access their Indian health, their IHS or tribe facility too.
Excellent. Can a tribal entity employer pay for premiums of a Native employee in the marketplace? So I'll take this question. A tribal employer cannot purchase insurance for a Native employee in the marketplace. They can choose, if they do the numbers and think it might be cheaper for Native employees, to go to the market to not offer insurance to their employees. If they don't offer insurance to their employees, there is a tax penalty that will accrue based on the number of full-time employees they have, and the cost can get pretty expensive. However, tribes as entities can sponsor tribal members in the marketplace and purchase private insurance for them. So whether they're an employee or not, tribes can purchase health insurance for their members in the marketplace. And again, you can use our calculator on the website to try to determine what kind of revenue that might bring to your local clinic. Does a veteran with the VA still have the opportunity to go to the marketplace? So if you have TRICARE or access to the VA, like you're an active military service member, then you will not be able, again, this is sort of the same thing as your employer-sponsored insurance. If you already have affordable insurance, then if you go to the marketplace, you won't be eligible for the advanced premium tax credits that reduce your monthly payment to a issuer. You can still go to the marketplace and purchase insurance, and get the cost-sharing reductions that are for American Indians and Alaska Natives under 300% of the federal poverty line, but you will not qualify for the advanced premium tax credit. Does a private health care provider have to accept Medicare reimbursement rates for Native American patients who incur services at a private health care provider? Jen, can you answer that question?
I can't actually.
I'm not sure. We'll have to follow up.
I'm not comfortable with answering that one. We can get back to you on that, though.
Mr. Casper, we'll get back to you because I'm not sure we have a good answer for that question. Okay. So if a tribe offers insurance to employees and the employee does not take the insurance, will the tribe be penalized? If an employer offers insurance to its employees, what they need to do is keep documentation that says that the employee declined the coverage. Because what's going to happen is that that employee or the employer is going to be penalized if the employee goes to the marketplace and gets a tax credit or a subsidy of some kind. So here's how it will happen. The employer will offer insurance to the employee. They're going to say, no, I don't want your insurance. Then that employee is going to go to the marketplace and either try to qualify for Medicaid or purchase private insurance. If they purchase private insurance and get a tax credit, that advanced premium tax credit, then the IRS is going to come back to the employer, the tribe, and say, Susie got an advanced premium tax credit in the marketplace. You owe us this much money in tax dollars because you didn't offer her insurance. And then the tribe is going to have to say, no, I did offer her insurance. Here's my documentation that my insurance meets minimum value, is affordable, and that Susie declined it. So you just want to make sure that your business offices have a process where they're collecting that information and are doing and are sort of keeping that on hand for when the IRS comes back and asks those questions. One question that came in is, what if a tribe is tax exempt? So we have a whole different module on tribal employers and their responsibilities under the law. So if you have a lot of questions and you think you need a full training, send us an email or get in touch with, you can actually send an email back to the registration email that we sent out and just say, we need some more information. Basically, the only way that tribes do not have to provide insurance to their employees is if they are a 501c3 and not listed as a tribal government. We know that tribal governments are tax exempt in some cases, but that does not exempt them from purchasing health insurance for their full-time employees. So I'm not going to go into a lot of detail because this was about the individual marketplace, but we will follow up and answer your question and maybe try to get you in another training. Okay. I think we've answered all the questions we can answer today. We're at the 1:30 mark. We promised this would only be an hour and 15 minutes. If you have follow-up questions, what we'll do is we'll take all the questions from today, from the webinar, and compile answers and post them to the website. So if you asked a question today and we didn't read it verbatim, it could be that we felt like we covered it in another question. So please visit the website in the next week or so. We'll try to get answers up. There were a lot of really great, awesome questions today, and we want to make sure we get those answers out to you. There are some that we simply don't have answers to, as we went over today, but there are some that we felt like we could give good answers to. We'll post them to the website, and you can take a look at them. You can also follow up with an email to tribalhealthcareweb@gmail.com. You can also use our website to contact us. So if you just go to www.tribalhealthcare.org, you can drop us a message, an email that says, I have this question, and we'll respond to you in the next couple of days or so. So if you actually look at the screen, the tribalhealthcare.org is this logo at the bottom, and you can just you can visit that website and ask questions, look at our materials, whatever you might need. Jennifer, are there any last remarks, or Nick, that we can answer?
I just want to say thank you all for joining the webinar too, and please keep sending in those questions. And we know that if you have those questions, many other individuals throughout Indian country have similar questions. So we're here to help, and if you need anything, please let us know.
Thank you, everyone, for joining today. We really appreciate it, and if we can help, please be in touch, and we'll do our best to get you the right answers. Thank you.